Hey, you must be Julia Malone?
Yes, it's nice to meet you.
I'm Dr. Marcus, as you can tell. What seems to be the problem?
I have really bad abdominal pain. It's really hard for me to go to the bathroom. I vomit occasionally. I have few bowel movements and stuff. So.
And how long have you been having these symptoms for, Julia?
About a month, but it just keeps getting worse.
And do you get any fevers or chills?
No, never.
Well, I think that rules out the other thing I was thinking about. It only leaves one choice, one option. Neurasthenia.
Okay, so how do I get better?
Well, for neurasthenia, we typically prescribe the rest cure. That entails laying in bed for about 6 weeks. You're not really allowed to do anything. There's no reading, there's no writing. If you have family members, you can't really see them. No dogs. You can't feed yourself. No drinking. Everyone else has to kind of do everything for you. It's a pretty relaxing experience, I think. Hey, you must be Julia Malone?
Yes.
Dr. Miles Marcus. So, what seems to be the symptoms that brought you here today, Julia?
Well, I feel like I'm constipated, but I don't know. I have my stomach, I have abdominal pain, and I occasionally vomit, and I have very few bowel movements, so.
Well, Julie, after looking at all your symptoms here that you've told me, I think we're going to have to do some testing. I think I might need to take a stool sample really to reassure things and really kind of focus in on what you really have. So if you don't mind coming with me to the room.
Okay, that sounds good.
Well, Julia, we got your lab results back. Well, it seems that you have this condition known as IBS, which stands for irritable bowel syndrome. Now, how we usually prescribe this is one, lots of fiber. So if you have any fiber supplements, eat lots of vegetables, lots of fruit, lots of lettuce. Also drink a lot of water and make sure you get plenty of exercise during the day to make sure, everything runs pretty smooth. Hi, what's your name?
Hi, I'm Danny. Nice to meet you.
Hi, I'm Dr. Marcus. So, Danny, what brings you here into my office today?
Well, my husband actually made me come. He says that he can't ever sleep at night because I'm constantly snoring, and then sometimes I just kind of feel shortness of breath, and it's just kind of hard for me to breathe while I'm sleeping. So he basically told me to come in because he started sleeping in a different room now.
And how long has this been occurring for, Danny?
I have never really noticed it that much besides the breathing shortage, but in the past month, my husband has asked me to sleep in a different room.
So let me get this straight. When you sleep, sometimes you'll be sleeping like this, and you'll go. Or wake up, shortness of breath kind of?
Yeah. What is it? I don't know what's wrong.
Danny, I've seen many cases of this before, and what you have is called neurasthenia. What you have to do is basically follow the rest cure. What that entails is you're going to have to stay in bed for the next 6 weeks and do absolutely nothing. Cut out all activities. So Danny, what seems to be the problems that's brought you into my office today?
Just been having trouble sleeping at night. My husband has made me move to another room because he says I've been snoring too much and it keeps him up. I also feel myself struggling to breathe at night. It's just hard to really get the air up. So I was wondering if there's anything you could do about it.
All right, Danny, I'm gonna have to take a look at your throat really quick just to make sure everything's up to date.
Okay, sounds good.
Say Yeah. Well, Danny, it seems that you have sleep apnea. I know this isn't what you want to hear, but I have a name of a great surgeon who I can prescribe to you, who can open up your nasal passages and allow you to breathe better at night and not have that kind of, when you wake up. Hi, I'm Dr. Miles Marcus. What's your name?
I'm Emily.
So, Emily, what brings you to my office today?
Well, I don't know, just lately I've been really stressed out and my heart rate is just going so fast, and sometimes I have trouble breathing, and I just keep thinking about the dinner I have to make, breakfast I have to make, taking the kids to school, and just everything's just stressing me out so much, and I don't know what to do.
Well, based off of your symptoms, it seems like you're caretaking a bit too much.
Yeah, so what does that mean?
Well, Emily, what that means is that you have neurasthenia. And the solution to neurasthenia is called the rest cure. what you're going to have to do is you're basically going to just have to lay in bed and do nothing for the next 6 weeks. No cleaning, no caretaking, no cooking, nothing. You're not allowed to feed yourself. You have to sleep in that bed. You're not allowed to drink, and you're not allowed to read, and you're not allowed to write. Understood?
Okay, that sounds good.
Yeah, if you follow my plan exactly, you'll be able to return straight away to your domestic. Hi, you must be Emily.
Yes.
I'm Dr. Marcus.
Nice to meet you.
Nice to meet you. So Emily, what brings you in here today to my office?
Well, lately I've been feeling extremely stressed out. My heart rate is always up. I have trouble sleeping sometimes. My breath is like very short, and I'm always thinking of everything I have to do in a day, and I just can't function anymore.
Emily, I know you're anxious, but do you mind if I check your heartbeat just to make sure it's not, heart attack coming on right now?
Yeah, absolutely.
Let me skip this. I can give a deep breath. One more. Last one. Yep, it's just what I thought. Yeah, Emily, you have generalized anxiety disorder. So what I'm going to do for you is I'm going to write you a prescription. I'm going to have you see my psychotherapist friend named Dr. Albert Buckman. So he'll take care of you pretty good in that department. And also I'm going to prescribe these Xanax pills for you to take twice daily. And as long as you keep to all this medication and see the psychotherapist Albert Buckman at least 3 times a week, you should be set. So there you go. Hi, you must be Charlotte.
Hi, yeah, nice to see you, Dr.
I'm
Marcus.
Dr. Marcus. Yeah. So Charlotte, what brings you in here today?
Recently, I've just been feeling really exhausted. I just don't have the energy to work out like I used to or do any of the other activities. I just have to nap all the time, and I constantly feel fatigue and exhaustion.
Yeah, Charlotte, I think you have neurasthenia. Basically, you're just going to have to follow the rest cure. You're going to have to stay in bed for 6 weeks and do absolutely nothing. Cut out all activities and you should be pretty good. Hi, you must be Charlotte. What brings you here today?
Hi, yeah, I've just been really tired recently. I've had no motivation to do anything, really, and I need a nap all the time.
Hi, Charlotte, I'm going to have to do a medical examination on you. I'm going to just take your blood pressure really quick. Let me just apply this here. You're going to feel some slight pressure in your arm as I blow this up. Hold on. Okay, you're good. Alright, I'm just going to draw your blood. Alright, I'm going to take this to the lab. Well, Charlotte, after looking at your blood results, I figured out that you have type 2 diabetes. I know this may seem hard to hear, but there are some steps you can take in order to deal with your condition. Some things that we usually prescribe is diabetes medication, including insulin, so you're going to have to keep up to date with the medication. I would suggest taking your blood glucose levels at times and also seeing me regularly in case you have any problems.